I think we should also think in those terms. Thanks to Dr. Amit, Balgopal, Sudan, and Pravin for providing me this opportunity. Just 1 hour late, don't worry. If everything happens in time, we may lose our identity as a Nepali. So, lage raho. What I'm going to present today is about rare cases of seizure. My plan of presentation will be, I'll talk about brief introduction, classification, then I'll discuss about case series and some take-home message. I'll not go into this introductory part about prevalence, epidemiology and all. We all know the scenario, at least 1% prevalence in Nepal. We have huge burden of seizure disorders, always demanding quality management. Known since antiquity, not the whiskey though, known since antiquity, it has been named different things, it still carries the stigma. Despite that, we know that there are many learned people who were highly respected and had merit, had seizure disorder and had a successful career. So maybe this preaching about this will reduce some stigma from our patient. It is very common in medical practice while evaluating a case of fainting attack or, for matter, clouding of consciousness. We health workers, medical officers and we doctors usually would say there is no uprolling of eyes, deviation of angle of mouth, frothing from the mouth, tongue bite, abnormal jerky movements of limbs, bladder and bowel incontinence. So seizure is ruled out. Have we ruled out the seizure? I think according to the International League Against Epilepsy definition, we have just ruled out generalized tonic clonic seizures. So we as a teacher, I think we should stop confusing our student, giving them that statement. There are more variants of seizure in classification which we tend to ignore is the above mindset, thwart or assessment. So in this presentation we will be discussing about case series of epilepsy without moves and shakes. I'll not go into the details of this international classification. There are many variants we know. Let's not only talk about movers and shakers on. So I'll be presenting 3 cases that we encountered in our clinic, 2 of diachronistic seizure and 1 of elastic seizure. Diachronistic seizure are characterized by paroxysmal episodes of stereotyped crying. The majority of the reported seizures appear to be triggered in the hypothalamus and seem to be frequent in individuals with hypothalamic hamartoma. However, in rare cases, it may also occur beyond hypothalamic lesion. Such cases are reported here. Case 1, a 3-year female child was brought by her mother with complaint of crying, waking up from sleep at night without any apparent reason for past 2.5 months. The inappropriate crying lasted for 15 to 30 minutes and occurred most of the days with gap of 1 to 2 days a week without any associated symptoms, and the child did not recall any of the episodes. There are no significant past history and family history in the patient. The patient came to us after visiting many centers. By that I mean the traditional healers. Unfortunately, they didn't find an exorcist in Nepal, so they couldn't do that.